Good afternoon to everyone. Good afternoon.
Good afternoon.
Enti Naomi and what their cohorts no. When you enter the class, don't you people realize that you've entered the classroom? Or because it is online, you people feel that it is not a classroom. So you just do whatever you like. The way I am sitting in my chair and I am smiling to myself because the whole of the semester, all of you together with your reps have decided to frustrate the system. I gave them 2 hours so you can get your groupings and do a very important class exercise. But as at now, I don't even have the correct groups. Your other counterparts, I gave them less than 2 hours. All centers have been able to submit their names. But Kumasi Center there, we are many. It's 3 or 2 people. Instead of them writing different names, you want to write names, bringing every name together, duplicating and triplicating names. You see, this thing that you people have done, you've done it to yourselves, so no dear. Me, I'm sitting my somewhere, I am laughing. Because on the norm, ask everybody. They will tell you. When you have the chance of doing these presentations, you realize that as you do the presentations, they are corrected so that everybody will have a level field. Because whatever groups present, just only one, similar one of them, resurfaces at the end of it all. So as you people have managed and have succeeded to delay the system, after the sharing of the groups is completely done, since you don't want any lawful thing, I will give those things, those preambles that you were supposed to have presented them in class exercise and presentations. I'll give it to you as an assignment. I'll give it to you as group assignments because the semester has ended, so that we can all go in peace. When people don't want to learn and when people want to fail, you help them fail. Some of us, I can't be stressing and frustrating myself because I want students to do the right thing. Everything you will tell me, midwifery level 300 students against God. They have an excuse. Go and ask your level 400s, those before you. They had the opportunity to have a class exercise yesterday, so that at least if you are present and you're involved in the class exercise, it can give you some score that will help boost your CWA and your continuous assessment, because that porous thing you people want to do there, some of you could not even get access to that platform. So it means that if there is supposed to be a 10 mark on that, it means that you've even lost that 10 marks. Those of you who could not present there, it means you've lost the 10 marks. Come and do class work. I woke up at 3 a.m. to make sure you see, I stopped that team no group thing because some of you have put this something message on your platform. So all that you people sent to me were gone. So I had to devise another strategy. You are just one center, Kumasi Center. Go through a list and submit your name to any of the reps that I mentioned on the platform. People decided to submit both names, their one name to both reps. Who will be wasting time to do these things? Some of these things you do and it costs you, the students. You think you are frustrating the lecture. Me, who can frustrate me? No student can frustrate me. We just try every means possible. We just try every means possible to get you do something, and you will also try every means possible to give an excuse. I mean, what was difficult about writing names? What was difficult about it? Tell me. What was difficult about it? Those in the other centers, are they also not students like you? How come they were able to organize themselves every time Kumasi Center? I believe that if I had even given it to just one of the reps, I think sanity would have been there. Indeed, I don't worry students, but if you are a student and you don't like discipline, most of the time you will not like me. You will think that it is you people that you don't want any discipline in your life. Anything that is discipline is a no-no for a CODeL student. Anything that comes with discipline. Any lecturer that decides to be disciplined, you don't like the person. But if education, you don't want to be disciplined in education, what do you want? You are professionals. Anything. I was telling the year force, I told them that you didn't tell them. Anything you tell midwifery level 300 August, they have excuse. Something that people do with ease. You couldn't do it. Something that people do with ease. You people couldn't do it. You weren't able to do it because you want freedom. I've given you the freedom. The freedom will cost you. When you get to the exams room and you become confused, that is when you understand that sometimes discipline is the best thing to do. When you get in there and realize that this thing, because for me, I do part A and B, so get it there. You will write, you are not even many. Even 5,000 students have math scripts. That's a 2,000 plus or something. So you do a part B. And the part B is the reason why I was pushing for you to have group work, to discuss group work with you. And you people frustrated all the efforts. You made sure you have frustrated that effort. Somebody say me, I'm sitting my somewhere laughing. Because at the end of the day, who will suffer? It is you. Simple task. Every people will come, they will come, blah, 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 blah. 2 hours to write, you know that your name is not there. 2 hours. They give us extra time since morning. When I said it, I wanted that thing 10 or so. As at now, I don't have. Anyway, last week, what did you take home? What did you take home last week? real craft is a class win in Casa. What did you learn last week? Nobody learned anything. Yes, Millicent.
Doctor, please, last week I learned study designs, and you said we have observational study, cross-sectional study. We have divisions and observational study, and we have the cross-sectional study, the case control, and then the cohort studies. So with the cross-sectional studies, he said they are carried out at just one point in a time, and it's also called the prevalence rate. And with the case control too, it investigates an association between a certain factor and a particular disease, and it's also called the retrospective study. And then the cohort study, it also involves follow-up of an individual from determination to the exposure of a status or a subsequent disease, and it is also called the follow-up study or the incidence study. Thank you.
Thank you, Millicent. Let's hear from Christiana.
Doctor, please. Last week we did health promotion, and also we talked about the 3 elements, skills and strategies to ensure that people's health are promoted. And one, we said we have the good governance, and for that we said it is the responsibility to manage the public health. And we also talked about health literacy. That is the education we give to people on ways they can promote their health. And we also talked about the healthy cities. Please, thank you.
Thank you. Anything else? Anything else? Yes, Eunice.
Doctor, good afternoon. Please, last week I learned about the managing of an outbreak. And under that, you have to first treat the cases, then you prevent the spread of the disease, then you monitor the effects and you control. Thank you.
Thank you. Eunice, so you never remember that we have greeted ourselves. So when we are answering questions, we don't greet ourselves again.
Sorry,
Yes,
Doctor.
Lily.
Doctor, please. I also took home NUS stats, and we was about N stands for nutrition. We educate people about good nutrition, eating of good balance, and to build up their systems. And also, the E stands for exercise. We have to do aerobic exercises to burn fats in our system. Also, S also stands for stress management and realization. And that was why we were talking about we going out, taking ourselves out, enjoying ourselves. We shouldn't pressure ourselves too much. We shouldn't pressure ourselves, and we should be agreeable. We should be free. We shouldn't put on stress on ourselves. We also talk about water. We should have a good water system, good sewage system too in our service. So we should also take enough water in our system. That's what I took home. Thank you.
Thank you, Elom. Yes,
So please, I took home how to plan health promotion activity. And with that, you said first we should identify our goal. Then we should set objectives. Then we should identify the population of interest that we want to promote. Then we should identify our strategies, plan our activities. Then after planning of our activities, we will evaluate our outcome to see whether we need to improve it or not. Thank you.
Thank you. Mary.
Doctor, please, I also learned about the brief history of health promotion, which started in 1986 in Ottawa. Then the charter also held in November 21st in 1986. That is when the first international conference on health promotion was held. Then the charter also advocates for health, enabling all people to achieve their full potential. Thank you.
Thank you. All right. Thank you all for your participation. All right. So we are going to finish with health promotion. Since you people took a decision by yourselves not to get your groupings done, when I finish, I'm done. I'm trying to sort the other group out so that they are ready, so they can do their class exercise. Those of them that can get in there can get their score, and we move, and they will continue and submit. Some of us, we are just disciplined. We don't kill people. And I've realized that as for the midwifery students, we have been teaching you all this one. You people don't like discipline one bit. Any lecturer that comes to teach you and is disciplined, the person is like your enemy. The person is like your enemy. You think that that person is the enemy. And so you do all that you want to do to frustrate the person's effort to even encourage you people to learn. Life is all about choices, you know. So when you lay the bed, you sleep on it. When I told the year fours, they were just laughing. Said, you leave them alone. They will see their smoothness level. Because this thing we started, you are the only class that I've ever taught in Garden City that it has come to the end of the semester that you don't even have groups. Even those that come freshers, they are all eager to get their groups and to do their work, because these group works that we do, the class exercises that we do in class, and then we do a lot of discussions after presentation, helps people a lot, because this is the adult learning space. And for adult learners, you need a lot of these discussions to help you. But this group there is on record. I've put it on record. It's a no. It's a no for them. You want freedom, so I've given you that freedom for you to go and write whatever I wanted you to do for us to present in class. Go and do that thing as an assignment. I think that is what you want. But you should know that for assignment, where will you get me to come and do explanations for you? If it's an assignment, where will you get me to give you those explanations now that we have entered the revision week? Where? All right, so there is something in health promotion called behavior change communication. behavior change communication. Behavior change communication. All right, let me just mute everybody before Vivian or Cancer and her cohort will be disturbing us. They came here to learn. They didn't come here to play. All right, so this afternoon, we are looking at behavior change communication. So when we talk of behavior change communication, first of all, let's unravel what behavior change is. And therefore, we say that behavior change is actually, it has now become a central point or a central objective in public health. Behavior change. So it is a structured, which is often long-term process of modifying actions, habits, or routines to improve health, well-being, or productivity. Behavior change. And behavior change what happened? Okay. So when we talk of behavior change, we are saying that the person will shift from unhealthy habits, and it is often personal, driven by someone's personal motivation or environmental changes or external interventions. And when we talk of behavior change, it has become a central objective of public health and health promotion interventions because we want to influence prevention of conditions. We want to promote healthy living. And therefore, according to Nielsen et al. 2013, behavior change is often posted as a required individual adoption for avoiding or reducing the risk of ill health. Behavior change. So at any given point in time, you look at your lifestyle, you look at the situation you find yourself in. Sometimes it's as a result of a health threat. Sometimes it's a result of you becoming conscious of yourself, and then you change your behavior. Very, very necessary. So what are some of the key aspects of behavior change? We know that behavior change is not an event. It's not an event that you go there and you come back. It's a process. It's a process. So those of us who want to slim down and you think that let me drink instant something, no, it's a process. It involves stages. You need to contemplate about it. You need to prepare about it. And you need to take action and then maintain that action. Now, when it comes to behavior change, we have types. We have the individual, that is the personal habits. And then we have the population-based one. That is where we use public health approaches to improve safety or health. These days, the individual habits, people are ready. We are pushing it. I was telling somebody that I used not to sleep, but growing up, I realized that if I don't sleep, it affects me. So these days, I sleep. I make sure I sleep. I make sure I sleep. It also requires techniques. Strategies often include you setting up specific goals, monitoring progress, and reinforcing positive changes, sometimes known as nagging. You see, changing a habit I can stay up I can even decide not to sleep the whole night. Be reading students' projects and doing this and that and that. But it's not healthy. It's not helpful. And so these days I sleep. You make conscious effort. There are some of you don't like drinking water. Make that conscious effort. Put water drinking reminders on your phones. And then make that conscious effort to drink water. We all, because of luxury, because we have cars, or sometimes we have access to cars, we don't work. So try as much as possible to walk around when you are doing household chores. It's all part of working, it's all part of exercising. So you do all these things. Then challenges. Sometimes it is difficult because of our current unhealthy behaviors are often more immediately rewarding than future benefits. I tell you. You see, when you finish eating and then, sorry, you lie on the bed. Oh, you lie on the bed. You see, it's fulfilling. Because you feel that you finish eating, you are tired, so let me lie down. But we don't finish eating and lie down immediately. You need to walk a bit, at least 10 minutes walk should do. You see, do something, whatever you have eaten, do something, lift yourself up. But you see, the funny and interesting thing is that when you eat, you feel like sleeping. Sometimes the feeling like sleeping might even mean that your sugar is spiking due to maybe whatever you ate. You see, some people can even eat 5 balls of kinky. It's not that you cannot eat, but limit it. And sometimes eating plenty food is fulfilling. Eating, sitting down and eating food, having some of these junk foods and all those things is fulfilling. But hey, in the long run, it can affect you. So these are some of the key aspects of behavior change. What are some of the factors that influence our behavior change? The environment. The environment. The environment. Sometimes you find yourself in an environment where everybody is eating something. And so you think it's normal. You find yourself in an environment where everybody is behaving unhealthy, and you think that is normal. Sometimes you get into an environment and they realize that, hey, everybody is practicing healthy something, and you also join. Then education. Whether we like it or not, literacy helps. Literacy helps. Sometimes when you get a condition and you are asked to modify your lifestyle because of education, because of enlightenment, you are able to do that. Then the peer influence. Peer influence can make us do negative or positive behavior, but most of the time, the peers pushes us more to indulge in negative behaviors, especially at the adolescent stage. But hey, it can also influence behavior change, either positively or negative. And the media. These days, the social media, TikTok, if you go to TikTok and you pay so much attention, you can learn so many things there. Some are also not beneficial, but you can learn so many things there and then maybe change 1 or 2 behaviors that you think is unhealthy. One of them is that when you finish eating, please do not lie down. Move. Move from your seat. If you are that type that have been served, all of us, me sometimes, I get served most of the time because I have grown up kids. I hardly go and dish my food these days. And the possibility and the probability of you finishing eating and sitting down for them to come and pack the plates is very high. So move. When you finish eating, you move, pick your plates and your bowls to the sink. Move again and move a step further by washing it. You wash it. At least you exert something. You exert something. These days, all the smartwatches have these calculations and the rest, the steps and all those things. Be conscious about it. Be conscious about your steps. Be conscious about physical activity. do something. So these are the factors. Now let's look at the determinants of behavior change. What will make people not change their behavior, or what will make people change their behavior? Why might people not change their behavior? People may not change their behavior when they do not understand the message. Sometimes people say things and you don't even understand. If you don't understand the message, how do you change your behavior? If you don't understand what they are saying, you cannot change the behavior. Sometimes too, if you do not see yourself as vulnerable, you think that, oh, I'm 20 years, I'm in my 20s, I'm in my early 30s, I'm in my late 30s, I'm in my early 40s. So these things, there is not when I get to, when I'm growing. Hey, so if you don't see yourself as vulnerable, you might not change your behavior. And then trust, lack of trust with the person that is talking about the or giving the message. Sometimes you go to TikTok. Hey, TikTok have a lot of people who 1 year doctor, nutrition doctor, what, hey, self-acclaimed doctors, whatever, midwives, and they are there. And sometimes you hear some of the things and you are laughing. Then we have these people that also sit on televisions. We have these people that go around. You see, as for the herbal people, if you listen to them, hey. So if people do not trust bearers of messages, they might not change their behavior. They may change their behavior when they think that the short-term benefits of the current behavior outweighs the long-term risk. And sometimes you realize that some healthy choices are costly. In Ghana here, if you want to do more fruits and vegetables, you understand that it's costly, especially if you don't take the fruits, the localized fruits, and you want to depend on these foreign fruits. It's so expensive. It's so expensive, and therefore some people may. Then sometimes the recommended behavior may also conflict with their beliefs. Any questions at this point? 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 All right, if there are no questions, let's move on. Let's move on. So aside what we just talked about, the individual behavior, people's beliefs, people's attitudes, people's habits, and practices might also influence behavior change. All right. So having said this, what are some of the barriers? What are some of the barriers to behavior change? One barrier can be you, the individual. You, the individual, with regards to your risk perception. How do you perceive risk? If you perceive that HIV doesn't exist, even if you are a health professional and you still perceive that HIV does not exist, you will have sex indiscriminately. The health literacy of the individual can also be a barrier to self behavior change. And then self-efficacy, the ability, your ability to translate knowledge into action, your ability to believe in yourself, that you can do something, can also influence behavior, can be a barrier to behavior change. And social culture, you are midwives, and therefore, when we talk about social culture, you know a lot about social cultural issues that sometimes even prevent pregnant women from even eating nutritious diet. Because of, you see, they will tell you that when you even eat egg, your child will become a thief. All these things are there. So sometimes social cultural norms, social cultural beliefs, stigma can also be a barrier to behavior change. Now we want to change our behavior. We want to help community. You have been taken to Etikwa Beshia community and you have realized that the Etikwa Beshia community mothers do not initiate ANC early, and you want to help them change their behavior. It is no longer, when we talk of behavior change communication, it's no longer about the wholesale change where you go and stand somewhere and you are educating people. But behavior change communication, the BCC, is an interactive process with communities where you develop tailored messages and approaches, where you use variety of communication channels. To develop positive behaviors and promote and sustain individual community behavioral changes. It's very, very important. And so here, if the Ocheng Beriate community, after your inquiries, realize that it's all about the male counterparts that are hindering them from coming for ANC, you tackle them, tailor a message around that will educate the men. And so when we talk of behavior change communication, we are no longer talking about wholesale stuff, but we are talking about messages that have been tailored around people that will be beneficial. That will be beneficial to the people. And so BCC is a communication strategy which encourages individuals or communities to change their behavior. What are the elements of change? It's very important to understand these elements so that it will help the individual to change their behavior. The first thing is that we talk about readiness to change. Do you have the resources and the knowledge to maintain a lasting change successfully? If I want to go on a diet, if I want to go on a slimming course, if I want to go on a fitness course, if I want to go on a fattening course, the readiness to change, do I have the resources? You need to ask yourself. That is why sometimes people start a behavior change something and they stop because they didn't look at their readiness. The fact that everybody is doing a keto diet doesn't mean that go and join that keto diet. You need to assess yourself, the readiness, the resources, and the knowledge. Then barriers to change. Is there anything that is preventing you from changing? Sometimes the kind of friends that we have do not give us the opportunity to change, I tell you. Sometimes, oh, we kakrebi Last year, I wanted to modify my diet, and my mom came and she was like, I told myself that by 4 p.m. I'm done eating. And this woman didn't understand why I will be done eating by 4 p.m. So sometimes when she's eating, says that, oh, what's be back where by and then I will protest. And she's like, hey, why are you serious? So it's all about determination. So you need to also look at the barriers to change. Then likelihood of relapse. Likelihood of relapse. You see, there are certain situations, if you don't take care, you will relapse. You will relapse into your old behavior. You will relapse into your old behavior because there are people, there are objects, there are places that when you go, you cannot prevent yourself from not indulging in things, and therefore you need to look at the triggers very well. If you know that if you attend social functions, social gatherings, you will not be able to do whatever healthy thing you have set out to do, then you abstain from it. Sometimes you have to be mean to people, you have to say no, so that whatever you healthy thing that you want to do, you will be able to do it without any relapse. You actually have to identify those things, because if you don't identify those things genuinely, if you don't identify them, it will be to your disadvantage. So the stages of change, there are so many stages, even the social cognation theory. So if you look at the picture that I have here, we have the pre-contemplation stage, the contemplation stage. You see, the pre-contemplation stage, you are thinking. We have the contemplation stage, we have the preparation stage, we have the action stage, you have the maintenance stage, and definitely you will relapse one day. But when you relapse, you have to start all over again. The pre-contemplation stage. At this stage, sometimes you even deny. You deny that you are obese. You deny that you are even more than obese. And sometimes you are ignorant of the problem. Then the strategy is that rethink your behavior, analyze yourself and your action, and then assess risk of the current behavior. The current behavior you have just started or you are in, assess the risk. Then you get to the second stage, which is the contemplation stage, where there is conflicting emotions to do or not to do, to change this behavior or not to change this behavior. You sleep with every man you meet. You cannot say no. Then you come to the contemplation stage where you are contemplating. There are mixed emotions, but here you have to weigh the pros and cons of the behavior change. If you think that the change will help you, then confirm your readiness and ability to change, and then identify the barriers. All of us, the behavior that we want to change, we have barriers. Then it gets to the third stage, where is the preparation stage, where you collect information about the change. You experiment with small. If it is Greek yogurt that you want to substitute with sweet yogurt, you go and buy small in a bottle and try it and see. So here, write down your goals, Prepare a plan of action. Make a list of motivation statements. I can do all things through Christ who strengthens me. I am more than able to do it. Yes, you can do it, girl. Go for it. You can do it. You can do it. You can lose that 10 kilos. You can lose that 5 kilos. You can lose that 2 kilos. And you tell yourself that, you motivate yourself. Because you see, as for the people that are around us, they will discourage us. As for those that are around us, they will discourage us. So we do that. And then we come to the fourth stage where action is directed towards the goal. Reward your successes and seek out social support. So those of them that were doing the keto, they had keto WhatsApp groups. You see, you need that encouragement. You go to Facebook, we have Weight Watchers, you go everywhere, so that you support yourself. Like people are breastfeeding, exclusive breastfeeding. When you have the support group, it helps. Then the maintenance stage is the huge stage. It is the difficult stage, I tell you. You have to maintain the new behavior and avoid temptation. You have to avoid temptation. But remember to reward yourself. Avoid temptation. Avoid temptation. And lastly, there is what we call the relapse. Lastly, there is what we call the relapse. And this one, sometimes, when I say I don't eat after 4, one time I attended the program. When I came, I was very hungry. It was 8 p.m. I had to eat. And you see, you get the supporters, the children, oh, Udi and I there one day. But one day, as you are eating, you get back into the habit again. So identify the triggers that led to the relapse and recognize the barriers to your success. Reaffirm your goal and commitment to change and start all over again. You do that, you do that, you do that, and you will be fine. Any questions at this point? Any questions at this point? Any questions? Class A, if there are no questions, we are done. So you don't have any teams. No, the teams are not complete. So my whole 1 hour is going wasted. If I go and do it, that's, oh, let's have it, wahala will be in Kojukru. My DM will suffer. There are some of you, they don't even recognize the fact that they have course reps or whatever. They disregard them. Anything, even when you write sentences in blue, black, and white, they will still come to your DM. I don't know whether they want special attention or what. I have no idea. So my refs, since we have nothing doing, can we go in peace? So I can go and concentrate on the other class and give them what they are supposed to do. Yes, Gifty, your hand is up.
Doctor, please, I've sent the list to you.
And how will I be able to do this list? Auntie Gifty,
Doctor.
how will I be able to do this?
Doctor, we are many, that's why. Please.
The many is not an excuse. That is why I gave 2 people or 3 people to do this. You see, one thing I've realized is that anything your classmates tell you, you people, you do it. You are not firm. Catch and saw my time, living count. Yeah, the time, Nama. Time, they say they are mama. At the end of the day, who will be losing? Once more class, me say me have me hosa. Who will be losing? Otherwise, we will have to do it this way. All of you that have your groups, the groups will be there. Then we can create another 5, but that group, they will get their groupings, but because their names are not there, there are even many. This more class here, because I would have said that let me break you into the groups that is on the platform, people that have the groups. We do that. So that is what I did for the year 4s when the situation became unbearable. So they will have all the groups. Then we say that, oh, team no group, we add about 5, but more. Somebody will come to your DM and come and be writing, I don't have a group, hearing what we are saying. But there are people, you look for your team and you add. My team's near 32. You let me try. Let me try and do 40 groups. Okay. 40 groups, but there are groups that have their names already. Team abortion. Mention your group, the names of the group, then I add. Team abortion, team. No, few. Team age, I've muted them. Team attributable. Team attributable. Then we have team biomedical. Stop typing, I'm not looking at it. Team child. We have team parents. We have team diagnosis. Okay, some so munti umunya no umoye. Hey, team disparity. Oma so denene chain ewuro. Team entry. Oh, you know. entry. Ni bra na me penti. Team family. There's team family. There's team gender. I believe the teams have their own team incidents. Again, I'm sure we will disturb me. Team indicator. I've reached team indicator. The person that will be able to mention the teams to me should raise the hand. And I will modia. Team mobilization. I'll give the person access so the person can unmute and talk and tell me. So I will go fast. Team mobility. Okay, Esther Adoma appear. You have the access. Let's go. We've read team morbidity. Team mortality. Or not so you be no ntimi nkasa. Hey, yes.
Please, I'm about to talk.
Boy. Team odds.
Team, Sister, please, where are you? Team morbidity.
Team past.
Hey, then team mortality. Team odds. Team past. Team past.
Team period.
Team period.
Mm-hmm.
Team planning.
Obi na wote ade ne so ye high ne yenye ne den. O se yenye den. Me machine no so e freezy. Team what?
Team planning.
Mm-hmm. Let's go.
Team prevalence.
Team prevalence. Uh-huh.
Team psychological.
Mm-hmm.
Team ratio.
I'm coming. Team ratio. Mm-hmm.
Team reproductive.
Team. Yes.
Team risk.
Mm-hmm.
Team sex.
Mm-hmm.
Team social.
Mm-hmm.
Team sociology.
Sociology. Mm-hmm.
Team trust.
Trust and obey. Uh-huh.
Team unsafe.
Unsafe. Ni upon right.
Yes, doctor.
30 teams. Okay, so team 31, 32, 33, 34, 35, 36, 37, 38, 39, 40. If you don't have any group, if you don't belong to any of the teams, find yourself and join any of them. Menko ye team no group crown obi am this step masu. Mesua minyansa mo. Okay, so I am opening it. You look for it and join. You look for your team and join. That is how it works. So let's do 40 minutes. 40 minutes. 40 minutes. Please, I'm putting it on your WhatsApp, the WhatsApp platform. I'm putting it on the WhatsApp platform. When you tell people not to do things, they will write. If team gender is not there, all gender people should take one group and put themselves in there. Now, manage. So there are 3 questions. Choose one. You are 40. Choose one. When you decide, say, choose the idea you. Question 1. There is a cholera. There is a suspected cholera outbreak. Your expertise is to manage the outbreak. Question 2. Plan a health promotion activity to prevent malnutrition in pregnant women. There are 4 questions, so 10 groups each. All 10 of the groups, every group 10. Question 3. Plan a health promotion activity for pregnant women with anemia. Question 4. There is an outbreak. There is a suspected outbreak of H1N1. Manage the outbreak. So there are 4 questions. Choose any of them and then do your work. Please take screenshots and keep them. I will tell you what to do with those screenshots. So make sure you take a screenshot and then you keep the screenshots. A lot of them are there. They can't go. All right. I saw about 500 students sitting here. They don't even know how to get into their breakout rooms. You won't learn anything. Let me see if I've logged the platform or not. All right. Our time is up. I'm trying to see introduction to community. Menkyerɛ class biara mmerɛ sɛ class wei da. Hey, people were calling me. People were sending me message. I don't have a group. Help me. Hey. Okay, let me open the one person from each group should just write the name of the group and the question you answered. So write the name of your group. So if it's team social, write team social. Maybe you answered question 3 and just put question 3 there for me. Just write question 3. On that platform. Say why many ampona wabetwradi we go. Aha na yetie. Hey, Edio. Hey, ada Yesu beba. Baby. So next week, I will tell you what you will do before the last lecture. I will tell you what you will do before the last lecture. So keep whatever you have done. Those of us who have the groups and we know our groups, we can continue with whatever we are doing. Those of us that are from group 30-something something to 30-something something, you will have to hang on. You get your actual groups. So it's more like I want to know whether you are present so that when I take the screenshots later and you get your group, I can mark you and record your score. That is why I created that. I will actually one day would like to visit some of you and then get to know how you conduct yourself in your facility. CHRISTA, hey, who? Anyway, so next week, God willing, we will meet and then we will discuss what we did. Till then, do what I have asked you to do. I also tell you what you will do with the work you have started doing. You have to send the work on a PowerPoint presentation. So I will send you the template and show you where you have to send the work to. On this note, enjoy the rest of the day and have a great start to the week ahead of us. Baraka de Salah to all my Muslim students. See you, God willing, next Sunday, where we also try and talk about examinations as well. Okay, then.